Good morning, my good people. Let me start by welcoming you back to my YouTube channel and also start by appreciating the good work you are doing, the likes, the subscribers, the comments, and everything, however little it is, that you are doing to push this channel forward. Feel appreciated. Most of you people, especially those who have requested their topics, are commending my job, and that gives me more energy to push forward. That's why I always request those who have given their topics and the topic has not been discussed, don't give up. Just be patient with me and I'll discuss it in due time. And those who have not subscribed, please consider subscribing and support our content so that we may develop this channel to greater heights. We are still talking about malaria in pregnancy, and in this topic we will start by looking at complicated malaria in pregnancy. Complicated malaria in pregnancy. Parentero and malarious. Parentero means through the vein. Parentero and malarious should be given to pregnant women with severe malaria in full doses without delay. Parentero or intravenous antimalarials should be given to pregnant women with severe malaria in full doses without delay. Parentero artesunate is preferred over quinine in the second and third trimester. It doesn't mean that quinine is not safe in pregnancy. It's always safe, but this means artesunate gives much more better results compared to quinine during the second and the third trimesters. So, parentero artesunate is preferred over quinine in the second and third trimester because quinine is associated with the recurrent hypoglycemia or low blood sugars. So you can go for artesunate compared with the quinine because quinine leads to hypoglycemia or low blood sugars. Though artesunate is a bit expensive compared to quinine. Quinine is pocket friendly and locally available compared to artesunate. So let me repeat this again. Parentero artesunate is preferred over quinine in the second and third trimester because quinine is associated with recurrent hypoglycemia. In the first trimester, risk of hypoglycemia is lower, and the uncertainties over the safety of attempting derivatives are greater. In the first trimester, we have said that artesunate is safe in second and third trimester. What about the first trimester? That question is the one we are answering right now. That in first trimester, risk of hypoglycemia is low. We have said that in the second and third trimester, the risk of hypoglycemia or low blood sugars is high. But in first trimester, risk of hypoglycemia is lower, and the uncertainties over the safety of the attempting derivatives are greater. However, weighing these risks against the evidence that artesunate reduces the risk of death from severe malaria, both artesunate and quinine may be considered options during more evidence becomes available. This means that the two drugs of choices for complicated malaria in pregnancy, be it in first trimester, second trimester, or third trimester, is always artesunate or quinine. These are drugs of choice for complicated malaria in all the trimesters. The only problem with the quinine is that During the second and third trimester, it brings about low blood sugars or hypoglycemia. But in the first trimester, it doesn't bring about low blood sugars or hypoglycemia, but its safety is questionable. So let me repeat this statement again. In the first trimester, risk of hypoglycemia is lower and the uncertainties over the safety of the attempting derivatives are greater. However, weighing these risks against the evidence that artesunate reduces the risk of death from severe malaria, both artesunate and quinine may be considered options until more evidence becomes available. That means maybe we can have another drug that is more safer than this, but at the moment, these are the only two drugs which are safe in pregnancy, be it in first, second, or third trimester. Treatment must not be delayed. So, if only one of the drugs, artesunate, artemether, or quinine is available, then it should be started immediately. Treatment must not be delayed. So, if only one of the drugs, artesunate, artemether, or quinine is available, then treatment should be started immediately. Quinine treatment for severe malaria was established before modern clinical trial methods were developed. Quinine treatment for severe malaria was established before modern clinical trial methods were established. That means quinine has been drug of choice for some time. So, quinine treatment for severe malaria was established before modern clinical trial methods were developed. Several sorts of quinine have been developed, all formulated for parenteral use, but the dihydrochloride is the most widely used. Several sorts of quinine have been developed, all formulated for parenteral use, but the dihydrochloride is the most widely used. Peak concentrations following intramuscular quinine in severe malaria are similar to those following intravenous infusion. Peak concentrations following intramuscular quinine in severe malaria are similar to those following intravenous infusion. A point to remember: when you go to our health facilities, if you are being treated of malaria using quinine, that's why you will always find in second and third trimester, the quinine is always put as an infusion in 5% dextrose or dextrosaline. Reason being, the 5% has some glucose which will boost your blood sugars, because quinine tends to lower your blood sugars. Study suggests that loading dose of quinine, for example 20 milligram salt per kilogram body weight, which is twice the maintenance dose, reduces time needed to reach therapeutic plasma concentrations. Study suggests that loading dose of quinine, for example 20 milligrams salt per kilogram body weight, which is twice the maintenance dose, reduces time needed to reach therapeutic plasma concentrations. Maintenance dose of quinine, which is 10 milligrams salt per kilogram body weight, is administered at 8-hour intervals, starting 8 hours after first dose. Maintenance dose of quinine, which is 10 milligrams salt per kilogram body weight, is administered at 8-hour intervals, starting 8 hours after first dose, following initial parenteral treatment. Once the patient can tolerate oral therapy, it's important to complete the dose or treat with effective oral antimalarial using a full course of an effective ACT. Let me repeat this one. Following the initial parenteral treatment, once the patient can tolerate oral therapy, it's important to complete the dose all the treatment with effective oral antimalarial using a full course of an effective ACT into brackets artesunate, amodiaquine, or artemether plus lumefantrine, or dihydroartemisinin plus piperaquine, or artesunate plus clindamycin, or doxycycline, or quinine plus clindamycin, or doxycycline. Let me repeat this statement. It's important to complete the dose of treatment with effective oral antimalarials using a full course of an effective ACT. For example, artesunate plus amodiaquine, or artemether plus lumefantrine, or dihydroartemisinin plus piperaquine, or artesunate plus clindamycin, or doxycycline, or quinine plus clindamycin, or doxycycline. This marks the end of our video today. Thank you for your time. Thank you for supporting this channel. Let's continue subscribing, liking, and sharing my videos so that they may be recommended all over the world. Let's have a fantastic day ahead.